Bismillahirrahmanirrahim. Today we will discuss about the mandible. Now this bone is a mandible. It makes the lower jaw and it is the largest bone of the face, and it bears the sockets for the lower teeth. Now it has two parts. This whole is the body of mandible, and this one is the ramus of mandible. Now first of all we will discuss about the body. Now this one is the body. It has the outer surface. This is the outer surface. Then this one is the inner surface. This one is the upper border or superior border, and it is known as alveolar border, and it bears sockets for the lower teeth. And this one is the lower border, and it is known as base of mandible. Then outer surface. Now this one is the outer surface. In the center or midline there is a faint ridge that is known as symphysis menti. This is the symphysis menti. Actually this body has a right and left half, and these right and left half meet in the midline as symphysis menti. Now in the lower part of symphysis menti, this triangular shape projection is known as mental protuberance, and infralateral to the mental protuberance, here and here are the mental tubercles. Now these are the sockets for the incisor teeth, and just below the incisor teeth this one and this one is the incisive fossa. Now laterally this one is the mental foramina that lies below the gap between the two premolar teeth, and just below the mental foramina this line is the oblique line. Actually this oblique line is the continuation of anterior border of ramus of mandible. This one is the anterior border of ramus of mandible, and it become continuous as the oblique line, and this oblique line run downward and forward up to the mental tubercle. Then after that inner surface. Now on inner surface there is a line. This line is the mylohyoid line. Now below the mylohyoid line this fossa is for the submandibular gland, submandibular fossa. Above the mylohyoid line this fossa for the sublingual gland, sublingual fossa. Now on the inner surface of the symphysis menti there are four tubercles or spines. These are the two superior tubercles, genial tubercles or spines, and two inferior genial tubercles or spines. Just below the two inferior genial tubercles, this fossa and this fossa close to the base is known as digastric fossa. Then after that ramus. Now this one is a ramus, and it has four borders: anterior border, posterior border, upper border and lower border. Now anterior border is thin, posterior border is thick, upper border is known as mandibular notch, and this lower border is the continuation of base of mandible, and posteriorly it becomes continuous with the posterior border of ramus of mandible, and here it makes the angle of mandible. Then after that outer surface or lateral surface has the oblique ridges, and on inner surface or medial surface there is a foramina. This foramina is the mandibular foramina. It leads into the mandibular canal inside the bone, and this mandibular canal open on the mental foramina here. Now anterior margin of the mandibular foramina has a tongue-like projection. This projection is known as lingula, and just below the mandibular foramina this groove is known as mylohyoid groove. Then after that this one is the mandibular notch. Now anterior to the mandibular notch this one is the coronoid process, and this coronoid process is the upward projection from the ramus, and it has the anterior border which becomes continuous with the anterior border of ramus of mandible, and posterior border which become continuous with the mandibular notch. Then this one is a condyloid process. It has the head. This one is the head that makes a TM joint, and below this one is the constricted part is the neck, and anterior part of the condyloid process, this fossa is known as the pterygoid fossa. So these were the bony features. Then after that we will discuss about the attachments. Now for attachment, see that on outer surface of both body and ramus, anteriorly in incisive fossa there is origin of two muscles, mentalis and orbicularis oris. Now this black one is the oblique line. Now front part or anterior part of the oblique line gives origin to two muscles. These are the depressor labii inferioris and depressor anguli oris. Now close to the lower border or base there is insertion of platysma. Now posterior part of the oblique line gives origin to buccinator, and on the ramus of mandible on an outer surface there is insertion of masseter, and on the anterior border and coronoid process outer surface and on inner surface there is insertion of temporalis, and here you can see these are the facial veins, facial vessels. Then on the inner surface Here you can see this one is the inner surface. Now on inner surface, on the mylohyoid line, there is origin of mylohyoid muscle. Here is the submandibular gland, sublingual gland, and then from the superior genial tubercles there is origin of genioglossus. From the inferior genial tubercles, origin of geniohyoid. From the digastric fossa, there is origin of digastric, anterior belly of digastric. Then on the inner or the medial surface of the ramus of mandible close to the angle, there is insertion of medial pterygoid, and from the pterygoid fovea, on pterygoid fovea there is insertion of lateral pterygoid. Now behind the third molar tooth, here you can see this raphe is the pterygomandibular raphe, and behind it there is the superior constrictor muscle origin, and on lingula there is sphenomandibular ligament. So it was all about the mandible.